As you know, every day we're monitoring COVID-19 cases and hospitalizations in our region. And here's the latest from Ballad Health. 169 COVID-19 patients across their network today, with 46 patients in intensive care units fighting COVID-19. 37 of those ICU patients are on ventilators. And we have 4 pediatric COVID-19 patients today at the Niswonger Children's Hospital getting treatment. We're really focusing on children these days as the vaccine's now available for them. Let's check in now with the Ballad Health Chief Infection Prevention Officer Jamie Swift. First, Jamie, what's your reaction to the numbers today out of your health system about the numbers in the hospital, both the regular hospitals and also the pediatric hospital?
You know, we seem to have really plateaued in that 160 to 170 range. It's a little concerning. That's certainly a higher plateau than we would like to see. In all honesty, we're hoping to see that number come on down. So we're certainly keeping our eye on that. Anytime we have children hospitalized with COVID-19, that's really one too many. And so to have 4 really just stresses the need right now of vaccination and continuing to protect our community through all the measures that we know work.
Jamie, we're now a few days into ages 5 to 11 being vaccine eligible, which I know is something you've been anxiously awaiting for. What's been the response through your community vaccination center at the mall in Johnson City, your other locations? What's been the response of parents and kids to that vaccination eligibility?
The response has been overwhelmingly positive. When we got to the vaccine center on Thursday, when we first had that day to open to that age group, we had a line already before we could even get open. We stayed busy throughout the day, and then certainly those after school hours, we were just really, a lot of kids come in, pure excitement. I got lots of hugs and thumbs ups and thank yous, and really just kids that have learned about COVID, have seen the impact on their lives as well as their lives of their family, and we're just truly excited to be there.
So you've had a few days to hear about any reactions, if there had been any. Are you hearing about any adverse reactions to the vaccine from the kids within our region?
We are not. You know, I've actually heard back from some parents who their kids did really well, really no issues, went on to school the next day, and so we've not heard of any adverse reactions. Obviously, you may have those side effects like we have with any vaccine, sore arms, maybe some fever, things like that, but all those are normal side effects that we expect, but honestly aren't seeing a ton of right now.
I imagine some parents would have fears, concerns, as with any time you take your child for a vaccine, and as much as we're hearing about online just chatter and discussion about the COVID vaccine, what are some of the main concerns that you're hearing from parents who are just not really sure if they want to do this, and what is your main answer to them based on the science that you're seeing?
Honestly, the most question that we frequently get is, was this vaccine rushed? Was it studied enough in this age group? And so being able to share the actual trials with these parents, showing them the data, showing them overwhelmingly positive results in these trials in this age group has really reassured the parents that I've talked to. You know, that's why this vaccine for this age group was a little delayed beyond adults. They wanted to, we did the adult trial, but we know pediatrics are not just small humans, so there had to be this separate trial. And FDA and CDC took the time to do that, to get the data, to analyze it. We wanted vaccine back before Halloween. That was really a goal, but the FDA and CDC wanted to make sure they were following that process so we could confidently come to parents and say this vaccine is safe, it's effective, and it's going to protect your child.
And I think it's worth bearing. Do you think it's safe? As a mom and as a caregiver, longtime resident in this area, do you think it is a safe thing for children, an effective thing for children?
I do. We have looked at the data. We've looked at the data in our command center. We do not just take this blindly. I don't just take this and say, okay, yes, let's get go. We read the studies. We read all the information coming out. We look at the data coming out of those, and it is overwhelmingly positive. As we see what COVID can do in both children and adults, we've had severe cases in our kids. We've had severe cases to death in our adults. We know the devastation this disease can bring. And so the vaccine is safe, it's effective, and it truly is, any risk of vaccine is much smaller compared to risk of disease in any of our age groups.
Final question, Jamie. I know it's time to start talking flu vaccinations. Many families are already moving toward that. Is it possible to get the two vaccines at once? Do you recommend a separation? What's the guidance on that?
So it really is time to get your flu vaccine. If you've not done that, you can get those together. There's no time frame to wait. So if you're at a facility that offers flu vaccine and COVID vaccine and you need them both, go ahead and do that day while you're there. There's no defined time frame. You can do it back to back. So if you need Monday for one day and Tuesday for the next, really just as soon as you can get both of those vaccines, go ahead and get both of them.
And is the same for true for children as well?
Yes, yep, same thing.
Well, I know that it is a busy time for you and all those of the health system. It's also booster shot time. You're recommending, I guess it's time to pull out the calendar and say, when did you get your vaccine? And is it time to start thinking about that adult booster, right?
It is. So 6 months, if you had Moderna or Pfizer, you can have that booster at 6 months. If you had J&J, everyone over 18, they're recommending the booster for within at least 2 months after that J&J shot.
Jamie Swift at Ballad Health. As always, we thank you for your time here on News Channel 11. We appreciate it so much.
Thank you.